Identifying rare disease patients within health information systems is a key requirement that can be used to accelerate patient recruitment for clinical trials or to collect data, such as registries for research and public health purposes. This is also true for undiagnosed patients, who could be better identified and get access to genomics platforms throughout Europe, for example. Through the ERNs, they could benefit also from the shared knowledge in the medical field of interest within the rare disease community. This, in turn, could accelerate their diagnosis. For the patient, the diagnostic delay represents a lost chance to receive adequate treatment, which could be prevented if alerts in electronic health systems were in place. Finally, even without a precise diagnosis, the recognition of a patient's rare disease status is useful. This status can facilitate practical things like reimbursement of care, as well as more intangible goals like the social and psychological improvement of the patient. An increased visibility of undiagnosed rare disease patients in health information systems can also inform health authorities about patients' care pathways and their use of health services. This, of course, is a necessary step for the care planning process and the health economic cost impact evaluation. Being able to assess the population size of rare disease patients, including undiagnosed patients, will enable greater political measures, including financing for care and research programs throughout Europe. The comparable epidemiological statistics in EU countries will be a powerful tool to highlight the needs of patients, clinicians, and researchers in the field. In the framework of the RD project, a set of definitions were agreed upon by a dedicated expert group. Number 1. A diagnosis is a process that leads to assigning a disease name to a patient's clinical situation, or to the undiagnosed status. 2. Undiagnosed patients are patients for whom no clinically known disorder could be confirmed by a rare disease expert center after all reasonable efforts to obtain a diagnosis according to the state-of-the-art and diagnostic capabilities available. The recommendations issued during the RD project for coding undiagnosed patients are the following. Recommendation 1. Whenever possible, capture the diagnostic assertion for all rare disease cases. Use the options suspected rare disease, confirmed rare disease, and undetermined diagnosis. Be aware that the undetermined diagnosis should only be used when all reasonable efforts to obtain a diagnosis according to the state-of-the-art and diagnostic capabilities available were exhausted. Recommendation 2. Use the dedicated ORPHAcode you can see on screen, specifying the undiagnosed status, alone or in addition to a diagnostic assertion. This new code in the Orphanet nomenclature allows a specific and unambiguous designation for undiagnosed patients. Only patients coded with the new dedicated ORPHAcode will be considered as undiagnosed. Be aware that this code should be used to identify rare patients for which all reasonable efforts have been made by rare disease experts to determine a diagnosis according to the state-of-the-art and available diagnostic capabilities, but these efforts did not enable to determine a clinically known concept. Please note that the use of this code can be combined with other descriptors, specifically to be compliant with the European Joint Research Centre set of common data elements for rare diseases registration. Registries should also provide a phenotype and a genotype description of undiagnosed patients. When this code must not be used. The code must not be used for diseases that are not yet available in the Orphanet classification. For a missing code, please use the online ticketing system available on the RDCode website. You can find the link in the video description. This GitHub allows requests to be sent to the Orphanet team and to keep track of the status of the issue. The code must not be used for coding patients throughout their diagnostic pathway. Use this code only after all reasonable efforts to obtain a diagnosis according to the state-of-the-art and diagnostic capabilities available were done. Because of the latest point, it is recommended that only experts in rare disease centers where available should be allowed to use this code. If these undiagnosed guidelines are taken into account, European interoperability of coded data on undiagnosed rare diseases will be ensured for the long-term benefit of the patients. More information can be found in the guidelines about the coding of undiagnosed rare disease patients on the Work Package 5 section of the ORPHAcodes website. You can also find the general guidelines for rare disease coding as well as a video on how to code rare diseases with ORPHAcodes. Finally, bear in mind that the ORPHAcodes partners are launching a virtual community of practice to share experiences and build the capacity of other organizations interested in implementing ORPHAcodes into their systems. If you're interested, please follow the news on the ORPHAcodes website.